The panelists here with me this evening, I will introduce them all, give you a brief bio on them, tantalize you with topics that they may talk about. They are free to go in another direction. They will each have a designated amount of time to talk, and then I will come back and do a bit of summarization, and we will open it up for the audience. One of the things that we really appreciate about Sharper Focus, Wider Lens is the audience participation and the fact that you get to throw things on the floor that maybe were discussed or not discussed, and the panelist tries to figure out how to roll with it. The panelists all know that it is not their job to make their talks connect. So if you feel like they're all saying different things, that's okay. We intentionally invite people from different perspectives across the university because we're tackling large topics that take disciplines and perspectives and fields from a wide variety of areas, and we're trying to signal that there's no one perfect solution, and the only way we're going to get to a solution is by talking with one another and bringing our different perspectives. We are not going to solve any problems tonight. We may have some suggestions, but the whole point is that this is the beginning of the dialogue, not the end, and we encourage you to continue talking with each other and our panelists. So on tonight, as we talk about Flint, one of the things to think about is that although the city was founded in 1819, it was incorporated in 1855, the same year as the founding of Michigan State University. The city's strong rise in the 20th century was of course tied to the auto industry, as was its decline in the last 40 years. Both Flint and Lansing have been linked but have two different paths of urban history in the last quarter of century. While Lansing managed to save and expand its two General Motors plants, Flint dropped to having only 8,000 employees, 1/10 of its past workforce. Flint has a strong educational and cultural heritage, as well as significant benefactors, the Mott Foundation being a key example. And these benefactors have contributed to the building and rebuilding of the city of Flint. Flint is home to nearly 100,000 residents. Their stories are complex, far more than a postcard of decay and despair, and deserving of much more than a media soundbite. Here with us this evening, we have, to my far right, Mary Schultz, Associate Director for the MSU Extension Center for Local Government Finance and Policy, and a visiting specialist in the Department of Agricultural, Food, and Resource Economics. Prior to joining the faculty here at Michigan State University, Mary was a Federal Affairs representative for the National Association of Mutual Insurance Companies and Crop Insurance Research Bureau. She was also a legislative assistant to Congressman Nick Smith in Washington, D.C. Mary earned her master's degree in agricultural economics from Michigan State University. To Mary's left is Deborah Furr Holden. She is the C.S. Mott Endowed Professor of Public Health in the College of Human Medicine. Furr Holden is an epidemiologist with expertise in drug and alcohol dependence epidemiology, prevention science and environmental strategies, and structural intervention for violence, alcohol, and other drugs. In the last decade, her work has focused in large part on developing environmental strategies and structural interventions for violence, alcohol, tobacco, and other drug prevention in high-risk and urban settings. She earned her doctorate from Johns Hopkins University. To my immediate right is Rick Sadler, an assistant professor in the Department of Family Medicine. Like Professor Furr Holden, he engages in Flint public health research through MSU's College of Human Medicine's Division of Public Health. Sadler's research is aimed at strengthening the understanding between the built environment and health behaviors and outcomes, with the goal of shaping land use policy to build healthier cities. He earned his doctorate from the University of Western Ontario. To my immediate left is Manuel Chavez, Director of the Information and Media PhD program, and Associate Professor in the School of Journalism. His research focuses on risk and crisis communication, government relations with the news media, and international journalism. He teaches courses on research methods, crisis communication, media law and ethics, courts and media relations, and press in the Americas. Chavez earned his doctorate from the University of Wisconsin at Milwaukee. And finally, to my far left is Trixie Smith, Director of the Writing Center and a member of the faculty of the Department of Writing, Rhetoric, and American Cultures. Her teaching and research are infused with issues of gender and activism, even as they revolve around writing-centered theory and practice, writing across the curriculum, writing pedagogy, and teacher training. She is also the director of the Red Cedar Writing Project. Trixie earned her doctorate from the University of South Carolina. Now, it's possible tonight that you might hear Mary talk about emergency management in Flint, emergency manager in Flint. Where is the city going to get water in the future and how much it'll cost? Deborah might talk about epidemiology, health equity solutions. Rick may talk about using GPS to understand health disparities. Manuel may talk about media coverage of the Flint water crisis, and Trixie, photo and voice project with 8 to 14-year-olds in Flint. And I say may because when we bring them all together for the first crosstalk, these are some of the theories that emerge and topics that emerge. But we encourage them when they go back and they think about what they really want to bring forth in their limited time with you, we tell them to go wherever makes sense for them. And so if they deviate from those topics, it just means the wealth of what they had to share with you was such that they really wanted to narrow in on the nugget that they thought would make the most impact tonight. So if they don't touch on any of the topics that I mentioned to you, those are still in their wheelhouse, and you can ask them those questions later. And with that, I would like to have Mary begin.
Thank you. Thanks for this opportunity to participate in this forum this evening. I'm very much looking forward to the presentations from the other panelists. The Center for Local Government Finance and Policy has been working in the city of Flint for over 5 years. We've worked with elected and appointed officials and city staff. The center has received about $500,000 from the Mott Foundation to support our research and training efforts since 2011. Our research is focused on documenting Flint's chronic fiscal distress and identifying various contributing factors to it. Our training with Flint city staff and elected officials has been in an effort to provide various tools and services of helping them make more informed budget decisions. The reports the center has released on Flint are on our website, thrivelocal.msue.msu.edu. The center staff has also supported the work of the governor-appointed task force, the Flint Water Advisory Task Force, and we will soon be releasing a report on the decision-making surrounding the decision to switch to the Karagandhi Water Authority. So the story of Flint's financial crisis is really a story in 3 parts. Part 1 is the deteriorating economic situation that the city of Flint and its residents faced and continue to face. Part 2 is the state policy context that Flint operates in. And part 3 is the part about poor policy decisions that the city of Flint officials have made. The deteriorating economic situation that fueled Flint's fiscal crisis is not unique to Flint. Facing decades of depopulation, America's older industrial cities are facing chronic fiscal and service delivery challenges. Flint prospered for most of the years from the 1930s to the 1970s, but like many industrial cities, their economic vibrancy ebbed and flowed based on the condition of the U.S. auto industry. Flint's population has been leaving the city and moving to the suburbs, and the population that remains is older and poorer. Over 40% of Flint's residents are living below the poverty level. And the rate of housing vacancy increased from 1970 from 5.1% to 2013, it was 25.4%. Housing vacancies impact local government fiscal health because as property values decline, so do tax revenues decline. Unemployment tends to be higher in the city compared to Genesee County and the state as a whole. While there's been a drop in unemployment in the city of Flint since the end of the Great Recession, it's still higher. In 2014, it was 14%, and it's above the pre-recession levels. In 2000, it was at 8%. As you can see, the employment of Flint's 10 largest employers has diversified in recent years. Most notable is the expansion into higher education jobs. However, despite these increases in this area, the employees in the city are still roughly 2/3 of what they were 10 years prior. Flint's economic decline is tied to its tax base. Typically, the tax base is the primary source of revenue for local governments. However, not for Flint. Property tax has severely diminished over the last several years due to falling property values in the city. In 2014, Flint's general fund revenues comprised only 10% from property taxes. 24% came from income tax revenue, 32% from state revenue sharing, and 18% from service charges. An important consideration to attracting and retaining property owners is the level of taxation. Cities experiencing chronic fiscal stress often have the highest tax rates in their state. Flint's taxes are the highest in Genesee County. A homeowner in Flint would pay on average 37.7% more than a homeowner in 9 of the most populated communities in Genesee County. To highlight how difficult it is for Flint to raise revenue from property taxes, 1 mill levied in Flint raises about $500,000. 1 mill levied in Bloomfield raises about $10 million. Let's turn to Flint's path to receivership. Flint city government has been under considerable fiscal stress in recent years due to Flint's decreasing population, employment, and tax revenues. In 2001, an emergency financial manager was appointed and was in place until 2004. However, the city soon returned to fiscal insolvency. The cycle of returning to a deficit position after an emergency financial manager appointment ends is not unique to Flint. One baseline used to identify cities with chronic fiscal stress is repeated periods of governmental fund deficits, as shown here. So due to the city of Flint's structural deficit, increasing legacy costs, and accumulating debt, the review team appointed by the governor recommended to again put Flint in emergency financial management in the fall of 2011. 4 emergency managers were appointed by the governor during the 2011 to 2015 receivership period. Every state imposes laws with regard to financial oversight of local governments and school districts. These policies include debt limits and debt issuance oversight, tax and spending limits, auditing and accounting requirements, and budgeting requirements. Michigan is one of the most restrictive on local governments and their ability to raise local revenues. Some states allow, for example, local sales tax or a local gas tax to generate additional local revenue. Michigan does not. Michigan only allows a voter-approved city income tax. The Headley Amendment and Proposal A were designed to limit property tax growth. The net effect of these 2 limitations is that property values can fall rapidly, as seen during the collapse of the housing and financial sectors of 2008, and by design will rise slowly. Other state policy decisions take away revenue streams to local government. For example, the exemptions to business personal property that previously generated revenue for local governments. Business personal property is now exempt, and in its place is a state funding mechanism that may or may not generate the same amount of revenue. And if the state's track record for providing the promised state revenue sharing funding is precedent, then those funds will most likely be shorted also. State shared revenue is generated from a statewide sales tax. If state revenue sharing was fully funded from 2003 to 2015 for Flint, Flint would have received an additional $70 million more over that period. East Lansing, for example, would have received $23 million over that period. So this is not just unique to Flint. The bottom line is Michigan's restriction on property tax revenues, coupled with its shorting of local government to allow for full funding of the revenue sharing, has shown that the state has broken its promise to local government. The overriding belief that the state holds is that local fiscal distress is due to managerial failure and poor local decision making. And Flint can be painted with that brush, but it doesn't paint the full picture. State policies and broader economic conditions significantly influence and exacerbate local government's fiscal distress. Poor managerial decisions made by Flint officials included extending union benefits that the city couldn't afford, or using water fund revenues to fund police and fire expenses, to name a few. In a review prior to the emergency manager that was appointed in 2011, the general fund expenditures had exceeded revenues for the preceding 4 years. 2 years after Flint's deficit reduction plan was submitted to the state, the general fund deficit had actually more than doubled. Long story short, in 2011, the governor appointed an emergency manager for the city of Flint. So what did the managers achieve? Well, they cut personnel costs by reducing wages to police and fire unions. They increased employee pension contributions. They changed health care benefits for retirees. Other reforms include they implemented a user fee for waste collection, special assessment for street lighting, water and sewer rates were significantly increased, and the city residents voted for a $6 million increase in their property tax to support police and fire. In 2013, April, Flint ended its contract with the Detroit Water and Sewer and opted to contract with the Carragandi Water Authority. The city switched its water source to the Flint River in April 2014. By 2015, the state returned the city to its officials. It was no longer in a fiscal crisis, but the state had created one of the worst public health crises in recent history. Genesee County, the state of Michigan, and the emergency manager negotiated the Carragandi bond agreement and tied Flint's hands to the KWA. Flint was no longer a seller of water, but a price-taking buyer of water. The bond agreement, along with the sale of the city-owned pipe, legally and practically tied Flint to the KWA. When Flint residents' complaints about the water quality led to a vote by the city council to return to Detroit Water to protect the health of the people, the emergency manager did not allow this for cost reasons. The state should have made funds available to the city to do the necessary upgrades to its water treatment plant so the Flint River could have been treated properly. But the state didn't make this investment, and we all know how that story played out.
Thank you, Mary. We'll now hear from Deborah.
I'm hoping Mary can get my PowerPoint up. So this is a great place for me to pick up because I was sitting at my desk at Johns Hopkins, real comfy and cozy. I gotta say I'm super moved because when I went to Hopkins, there were, I think, about 1,200 students on the campus that might represent a small school at MSU. And in my class, 3/4 of the students were the valedictorian or salutatorian of their graduating high school class. And we were about 35% female. And I'm looking out at this audience, and it's like 2/3 women. And this is the honors college, right? I'm like super proud and happy to be here. We took the hour drive up to Flint to be with you guys tonight. So where you left off, Mary, is a great point, because I came to Flint from a very cushy job at Johns Hopkins. I thought I was going to retire from there. I lived here as a teenager. My mom married a man who hitchhiked to Flint from DC when he was 19. He worked for General Motors at the truck and bus shop on Van Slyke. And they filmed Roger and Me. Anybody know Roger and Me, the Michael Moore film? If you don't, honors college students, look up Michael Moore and Roger and Me. And it was real. I lived through that. My mom was like a very proud woman. She worked for a pretty prominent parking company in DC. And we came here, and she had this guy that worked for GM on the line, and he had a really fancy conversion van, and we thought we were gonna have a particular life. And he got laid off more than I can count. And when I was here, the city was more than twice the size that it is now. So when people talk about the city has shrunk in deindustrialization, GM used to employ literally the population of Flint right now. So the number of people that live in the city of Flint right now used to be the number of people that worked at GM, and now the number is somewhere between, 5,000 and 8,000? And so the impact is real, and the impact of the water switch is real. Myself and my colleagues that took these positions in the public health division, paid through the C.S. Mott Foundation, we all made a vow, and we moved into the city of Flint. And so I get this weird film on the water line in my toilet every month. I have no idea what it is, no idea where it came from, but it's real. I'm like living in the midst of this water crisis. I have yet to pay my water bill. I refuse to pay for water that's not potable. If the EPA says it isn't good enough to drink, I'm not gonna pay for it. We'll see what happens if they cut it off. Maybe I'll have to pay the bill. So what they brought me to do in the C.S. Mott Foundation is they are bringing public health professionals to Flint to actually deal with these problems. And I'll tell you, what would have somebody like me leave a really cushy tenure track position at Johns Hopkins, which I have this real illogical institutional loyalty to. I did my undergraduate and graduate studies there, and I truly thought I was gonna retire from there. But when I came here to take a look at Flint and what they were trying to build through the public health division, I got really moved. I got moved because I went to the house of one of my friends from high school, and I was shocked at what came out of his faucet. This was pre-water crisis, pre-big media. They were in the midst of the crisis, but it hadn't yet quite caught the attention of the media. And what came out of his water faucet smelled like what was in my pool, highly chlorinated. It wasn't quite clear. I put it in a glass, and I could see it was off color, and it had this weird odor. It was sort of like funk meets chlorine. Like, imagine you just left a sporting event, and instead of taking a shower, you put on cologne. That's sort of what the water smelled like. It was sort of like chlorination over top of funk. I'm just giving you the real experience of a resident. And so the Mott Foundation had already decided, in concert with MSU's College of Human Medicine and community stakeholders in Flint, that Flint was facing so many public health challenges that they wanted to do something and create a unique build for public health in Flint. So to that end, they are recruiting and soliciting public health professionals from a wide range of expertise across the nation to come in and do work that's gonna make a difference in Flint. And so when I came here, before I even took the job, I had a conversation with this guy who's a medical geographer. And if you don't know, medical geographers are super cool people. And you actually get to have many career options if you go into kind of GIS work, because he could have an appointment in the sociology, social work, medicine, geography, but he's in the College of Human Medicine because we know that place matters. And for anybody that looks at health, where you live shouldn't determine how long you live and the quality of life you live, but sadly it does. So one of the things that we did is we came together as a community before I even took the job got with some community folks and people in our department, and we decided we wanted to put something together, not just to describe the problems, but to actually create solutions. So I'm going to talk about some of the public health solutions that we've started to create from some of the problems that you described in the work that you and the very important work that Extension does, you know, given that MSU is our leading state land-grant institution. And so we know that Flint faces multiple public health challenges. And what I'll tell you as somebody who, as a public health professional and somebody who completed all the requirements for a master's in biostatistics, you can tell a really interesting story with numbers and statistics. But something happens when you look at statistics. If you look at a mean, there are many ways to get to a mean. You can get to a mean because you've got half of the population at 0 and half at 100, and then you produce a number where everybody's at 50%, but nobody actually fits that mean. That's what it sort of looks like in Michigan. If you look at mean stats across the state of Michigan, Michigan actually looks pretty healthy. But the reason Michigan looks healthy is because you have a lot of jurisdictions who are doing really bad, and then you've got some that are doing really well. And then they put all of them in the same pile, divide them by some denominator, and then it looks like generally the state is healthy. But it's actually not if you break it down into its smaller parts. So Genesee County, and particularly the city of Flint, which is the birthplace of General Motors, with deindustrialization and all the other things that happen, have left Flint in a very blighted state. But I don't want to leave you with just the problems, because, you know, we talk about the people that have stayed in Flint, and yes, it's true. Most of those that have stayed behind are the elderly and the truly underserved, the poor, the people that didn't have the option to vote with their feet, the people that didn't have the opportunity to experience the upward mobility that comes with financial freedom and prosperity. But I call them the Flint Riders. They are the people. There are plenty of people in Flint, and then there are people like me who moves to a water crisis, right? Like, I actually moved back to Flint in the middle of the water crisis because I got my early education there, and I got a stellar education that prepared me to go to Johns Hopkins on a full ride and sit in the seat that many of you sit in. So there's a lot that also makes the city resilient, but there are also great public health challenges. So the thing that I was asked to talk about is, well, Deborah, what are we going to do in the face of all of these challenges? And so what we've decided is that, yeah, we have a lot of good data and studies and ongoing opportunities to describe the problems, and they're important. Dr. Sadler did some very seminal work because the state looked at the problem of lead exposure among children at the level of zip code. And when you look at zip code, again, remember when I tell you statistics are like really interesting. You can almost mask or tell any story that you want to tell with statistics. And if you look at statistics in Flint by zip code, what happens is the problem gets diluted, because about half of the zip codes in Flint, some large proportion of that zip code actually falls outside of the city of Flint and isn't on Flint water. So you end up getting a denominator that's very diluted, so that numerator, i.e. the kids and the people that have been exposed, gets watered down by a denominator of people that don't actually even live in the city. And so it's important that we do good epidemiology, good science, good investigation. That's why we need folks like you, honors college students, fellows, people, I don't care what you're doing. If you're a journalist, if you are a math major, a science major, environmental health, we actually have to keep up and fight the good fight with the science of the work that we're doing. So myself and my colleagues came together and we put together the Flint Center for Health Equity Solutions. When I tell you it was a long shot, we wrote it in 3 weeks, highly unpredictable. They got 58 applications and they chose 2, we were chosen. And we chose to focus on solutions and not just descriptions of the problem, but we understand that good, rigorous investigation ongoingly of the problem is needed. And so what we do is we have a multi-tiered approach. We've got strong partnerships with community partners from a variety of sectors: economic development, health, behavioral health services, the faith-based community, the city health department, municipal officials. We have state and local elected officials. We have a strong, what we call a consortium partnership. We have a really strong methodology core that's led by Dr. Rick Sadler and has other partners on it. And we are trying to understand, both from an assets and a needs perspective, what does Flint actually have on deck? Because in the face of our many needs, we also have many assets. And then we have multi-level interventions, but they're not interventions that are just about people, because the solutions also have to match the level of the problem. So what was done in Flint was not, people with no strong will or commitment to their own health behaving badly. This was imposed on them, many of the structural challenges. If you'd asked the people of Flint 40 years ago, did they want GM to pull out, they would have said no. They wanted them to stay there. It was a big part of the vibrancy of the city. So our work is about having the solutions also match the level of the problem. So to that end, we're focusing on not just individual determinants of health, but the social determinants of health. The macro, structural, social, political, economical influences that shape and influence not just the city, but the context in which people live and experience health. So our future directions, we need good data. We need good, solid scientists. We need people that understand the difference between looking at things at the level of zip code versus a more granular level. We need people that have the passion and the commitment to tell the story as it is and not the one that fits a particular political agenda or even the agenda of an institution. We are also working on implementing and evaluating structural and policy level interventions. I don't know if you know, but they issued one of the federal government's attempts to help undo this problem is they issued a Medicaid waiver, making Medicaid available to women and children in the city of Flint. The problem is most of those people haven't accessed the waiver. So you would think, access to health care, that's the big problem. But we dealt with the access issue, but we haven't figured out how to get people to utilize those services. So we're dealing with many of the structural and policy level interventions that are going to be needed to build real public health solutions in Flint. And then we're also looking at systems level prevention and implementation science. So implementation science is the field of how do we take what we know works and scale it up to a level that's meaningful without diluting the impact of what we know works. And the last thing that we're doing is, as my colleague said, it's not just Flint. Flint is not unique. Once Flint came out on the map, a whole lot of other cities came out expressing similar issues, both around water and other types of structural deficits. And so what we think we have the opportunity to do is be good stewards in the world and be good stewards of public health. And how do you mount an appropriate public health response to a public health crisis and structural inequality? So to that end, we are mounting national studies of the impact of structural interventions. And I think that public health is sort of the key and the cornerstone for that. Thank you.
Thank you, Debbie. We'll now hear from Rick. We're stealing our cue cards up here.
It says, shut up.
Thanks. Good evening, everyone, and thank you for having me here. I'm Rick Sadler, an assistant professor in the Division of Public Health and a Flint native. Tonight I'll share with you how a geographic approach helps us understand urban problems and underlying patterns that we might otherwise miss, particularly with regard to my work on the Flint water crisis. And when I say a geographic approach, as Deborah mentioned, that includes disciplines not just in geography, but urban economics, sociology, anthropology, all across the social sciences, and as I'm learning now being a part of the College of Human Medicine, in medicine as well. So I've always thought of my work, or hoped to think of my work, as having a natural policy and practice relevance. And so one of the first things I typically do is question the broader significance of a topic that a topic may have to how our cities are laid out and how we can improve that. And one of my roles as a researcher is to use my skills to make these connections. So I want to share a few tools and concepts of a geographer in case you haven't been acquainted with those. So my work often centers on a tool for making computerized maps called Geographic Information Systems, or GIS. GIS allows the user to create, manipulate, and analyze any kind of data that has any spatial reference point. So you plop it down on a map, you throw an attribute on it, and then you can analyze what those patterns look like. The essence of the discipline of geography is that you are where you live. GIS provides a foundation for understanding spatial patterns and relating other phenomena through spatial analysis. These tools can also help us demonstrate the effect of spatially explicit interventions on subpopulations. For instance, road diet in a community, new grocery store, or the closure of polluting factories or schools. And it's this tool and theoretical perspective that I'm going to lace together tonight by highlighting some of Flint's past and present. So the thing is, we already know how to build healthy, vibrant cities. As we've heard, it's not just it wasn't a natural consequence of deindustrialization. There were deliberate decisions that were made that have destroyed our cities. And with advances in GIS over the past 20 years, mirroring advances in computing, geography is kind of afforded a part of this toolbox for measuring issues that have a geographic dimension to them and for informing decision making. So, but what happened in Flint, as I mentioned, it reflects a political failure. It's a general neglect of cities over many decades. The events that led up to the Flint water crisis and the cover-up that initially ensued were a classic example of both incompetence and willful ignorance. So, just to understand a little bit more about Flint's history, looking back a little farther, in the case of my hometown, I can use GIS to understand where we came from and where we are now. One example is shown here. So rapid growth between the 1920s and 1940s in particular brought a lot of growing pains as the use of discrimination in housing and employment created a bifurcated landscape. So the black outline in this map here is showing what was effectively referred to by historians as the color line, and that's the color line as of 1960. What this means is that nearly 100% of the black population lived inside that area. And if you have any familiarity with Flint, you might kind of see the outline of Buick City, the factory, kind of wedging itself up inside that northern section. And then the south side neighborhood, there were other factories and polluting industries down there. So this is a neighborhood that's overpopulated. The housing stock tends to be in poorer condition, and they have a much greater exposure to environmental pollution. So you can imagine the effects of living in these neighborhoods, not just in terms of social opportunities, but in terms of environmental pollution. Now, the demise of redlining and discriminatory housing practices also precipitated the exodus of thousands of white families from the city, as shown in these three increasing shades of gray. So in the 1950s, you saw half the white population leave that area in the middle. In the 1960s, that kind of moving toward the north and west, and then an area in the southeast, half of the white population left that neighborhood. And that was after the passage of a fair housing ordinance in 1968. And between 1970 and 1980, a whole additional section of the city in the northwest, half the white families left. So this is not just economic change. This is social fears manifesting itself as white flight. So you already have this population decline even before GM starts laying off residents, and then you throw on top of that the deindustrialization, the crippling urban renewal policies, whereby a lot of the old traditionally black neighborhoods were demolished, and disinvestment in the city, both by individuals and through state and federal policy that supported abandonment, and you're left with a landscape that's just waiting for a problem. So it's therefore not surprising either that the water system was vulnerable to deterioration or that the city administration was understaffed and unable to account for the possible leaching of lead from pipes when the state coerced them to change water sources. The dilemma created the need for researchers to come and uncover issues that the state was not finding. So last fall, Dr. Mona called me up and asked me to geocode or locate all of the addresses of every child in Genesee County, including Flint, and put them on a map so we could see where they were located and what their blood lead levels were, and then see if there were any patterns. And then the idea is to join them to other geographic variables. So the city of Flint outline, Flint wards, Flint neighborhoods, built environmental variables. And we were able to model where blood lead levels were highest, including in a concentrated area of Flint, which is shown in red here. So the countywide map was mostly blue to kind of light blue with a little bit of orangey color. But the only place in the county where blood lead was in this red area was in the north and west part of Flint, which is an older neighborhood, higher vacancy rates, and a whole series of built environmental factors that kind of increased its propensity for exposure. So we've been able to see how features such as water as residence time in pipes, the poor housing condition in older houses create this higher vulnerability for children. And the big finding here is that when we were modeling blood lead levels before the switch, the landscape was more or less homogeneous. There wasn't a lot of spatial variation, but we saw this really strong relationship after. Now, part of the reason this whole analysis was necessary in the first place was because, as Deborah has mentioned, there was this lack of understanding by state officials of the appropriate geographic units for analysis for defining blood lead levels. Their data was modeled at the zip code level, which are shown in blue on this map. So they were looking at any kid that had any of these zip codes in their address. They didn't plop them down on a map, they were just using an Excel spreadsheet, presumably. But the problem is that the Flint Water Network is 98% or 99% aligned to the city limits of Flint. So virtually nobody outside the city uses Flint water. And so they were basically 1/3 of every Flint address, of any Flint addresses, are not actually in the city of Flint. So you have a watering down of results by adding in an additional 50% of the kids. And all of those kids were outside the city. They didn't have exposure to lead in the water system, and so of course their lead level is not going to change. So when you look at that average level again, or the percentage of kids that are above an allowable limit, you're not going to find a big change in that. So the problem is that this data issue transcends the Flint case, because public health practitioners often speak in terms of how zip codes influence your health. And it is true that where you live influences your health, but we need to be even more precise than just zip codes. So what we need to use is other metrics already available to us, like census units, neighborhoods, or planning districts, when reporting geographically explicit information. And I wanted to give you a little bit of a geography lesson, in case you had never taken a class in this before. So this is a classic illustration of what we call the modifiable areal unit problem. This posits that the results of statistics aggregated by space will vary depending on the size, or a scale effect, and the shape, or a zoning effect, of the units used to aggregate data. In Flint's case, we had a major zoning effect, because 5 of the 7 zones included non-Flint addresses. Just a glance back, 48502 and 48503 are actually the only zip codes that are completely within Flint, and all the rest are capturing kids outside. And so on the bottom you see these different kind of funny shaped polygons, and they are categorized differently based on how they're drawn. And another example of the zoning effect, because that's effectively what was masking the Flint issue, is shown on the right. So you have, if you're looking at perfect square cells, it looks like there's only one cell that has a problem. If you kind of make them funky hexagons and pentagons, it looks like there's a couple of neighborhoods that have a problem. But depending on how you group them, and actually this is a good illustration of what happened in Flint on the bottom here, effectively it looks like the whole region is homogeneous. There isn't really much of an issue. And that's because you have this kind of pie-shaped effect where these are going out to the edge. So just to kind of give you one more example, and it's particularly apt since we're all voting tomorrow, hopefully all of us are voting. Another common example of the MAUP in action is the way districts can be gerrymandered to deliver a majority of seats to a party that may or may not even capture the most votes. The figure on the left shows examples based on their level of compactness and on the fairness of representation. So in 2 of the scenarios, there's a majority blue and blue wins. And in the other scenario that's neither compact nor fair, you have these weird serpentine shapes, and red wins despite having fewer votes. And just another view of this, and a solution that geographers are proposing and trying to insert themselves into state governments to get passed, is shown here in the example of North Carolina, where you could redraw the districts to optimize compactness, and then you have more logical boundaries. So just a few parting thoughts. From the policy side, it's clear that if we keep disinvesting in our cities, additional problems are going to pop up. It's only natural. Also, we know how to build healthier and better cities. We have whole disciplines committed to it. Public health and urban planning are increasing their collaboration together, and the tools of GIS allow us to describe the problems and look for solutions in a way that we haven't been able to. But we need more political will to do so, and a recognition that suburbs don't pay for themselves. Like, the way we've been building in Michigan has been very destructive. And on the data side, geographers I think, should have a seat at the table because I like sitting at tables. And that's the Flint case has demonstrated this necessity because the state was ill-equipped to deal with this issue. And that's just me, in case you want to look me up.
We're good.
Oh, yeah.
Thank you, Rick. Manuel?
Thank you very much.
Thank you very much, Cynthia, for organizing, John, for this wonderful invitation. I think that this is one of those events in which we can learn from each other. And I think that it was absolutely incredible that we were in this sequence, because what I'm going to be telling you is probably a composite of what the media missed. Okay? And I'm going to be illustrating some of these issues. I think that my slide is there, right? Yeah. Cannot even see it. Okay. As you can see, this is not only a project that is of the School of Journalism here at Michigan State University, but also of the University Cardinal Herrera in Valencia, Spain. And the reason that this started is because they invited me in March to go and do a presentation on the crisis in the US, in Spain, in Europe. So what are the major crises that the United States were facing? Because I teach crisis for journalists. So how the journalists need to communicate those crises. So I'm over there and they asked me two crises. He says, well, we're reading the news in Europe that there is a city in Michigan where you live that is very close, that is called Flint. And we wanted to know more about it. I said, absolutely, I have data, I'll be happy to share it with you. And the second one was before the primaries of the Republican Party. And they were trying to ask me why Donald Trump was possibly a candidate to actually be nominated to be the Republican candidate. For them, that was a crisis in March. In March. So when I was there, I started with the approach that I always use with my background. I'm a sociologist by training, so I think systemically. So the way that I work is trying to connect the dots. And this is what I spend most of the time in the classroom, teaching students to make a connection of how these things are linked to each other. So they are not isolated circumstances. And what you hear about the budgets, you cannot disentangle it from the issue of the characteristics of public health. And you cannot disentangle it for where the people who are in more disadvantage lived. And that's how the systemic analysis came all about. And ultimately, we came with an international and interdisciplinary project that is looking at governance, political accountability and transparency, and the responsibility of institutions. But here, I wanted to make sure that you know that as institution, we included the press, we included the news media. So what happened is that we came into a mixed methods of research very quickly. We did quantitative analysis, print content analysis, budget analysis. Then we did qualitative issues. We run focus groups. We did interviews. We did some interviews with some of the actors before the lawsuits. After the lawsuits were filed in court, that was it. We couldn't approach anybody, and other than obviously the residents. We did social media analysis. We're running a project right now in trying to understand how social media was used to communicate the crisis and how people use it in different ways. Our college, the College of Communication Arts and Sciences, developed a new app that is called Flint Now, that is supposed to help residents as to identify any kind of issues that are coming as an alarm, as a critical issue that they need to be aware of, and of course, having access to water. I always raise my hand and I said, is that in Spanish for those that don't speak English or read English? And the answer is that we're developing it, okay? So we did comparative analysis, and the primary materials that we used, it was the final report of the governor's commission, the task force that he created. And I'm going to read to you very quickly, because otherwise I'm going to get one of these red or yellow cards, is that I'm going to read to you the first sentence in the executive summary of the governor's task force. This is it. The Flint water crisis is a story of government failure, intransigence, unpreparedness, delay, inaction, and environmental injustice. Whoa. When I read that, I said, okay, I'm going to have work for the next 3 years explaining how all of those institutions fail, but more importantly, how the media missed completely the ball. So we use all the memos and the letters and the reports and the emails that were included in the final report, but of course we have some problems with the data. Part of the problems is that some of the critical emails from the governor's office were not included in the report. Some of the report that we needed from the federal EPA, we couldn't get access to them either. So we have some problems with the data, and of course, as I told you, we didn't have the capacity to interview some of the officials that were in the decision process, in the decision-making process of switching the supply, the water supply, because they were already in a lawsuit. So we hear already that the city of Flint faced a crisis, that the non-elected official, a city manager, was making decisions. But the question came about if this was a bad political decision or a bad technical analysis, and by whom, when, and how. That's what the media were supposed to be doing it. And then I wanted to call to your attention that one of the functions of the media, specifically I'm talking about the press, is what it's called the watchdog function. And in this particular case, in the case of Flint, the media means the opportunity to ring the alarm bell. Even when Mark Edwards from Virginia Tech was presenting the report on the quality of the water, the media just had very small briefs at the national level. At the state level, at the local level, it was kind of like, yes, but not really. Yeah, the report is there, but we don't need to pay attention because the state is telling us that it's not true. And that was part of the issue. Then when Dr. Mona Hanna came and did the report, that was a very interesting situation because also the media missed the ball completely, because there was some efforts by the state officials in order to discredit her. And the media, unfortunately, the local media and the state media, you need to recognize it, also missed that opportunity to go deeper and analyze thoroughly the report that Dr. Mona Hanna was presenting with the results of the poisoning. We did a sample of the timeline, as you can see here, but by the time that the mayor declared that the emergency in the city of Flint is when time really, you promised me more, Cynthia, is when the actual news got the first launching of the poisoning of the city, the poisoning of American City. But as you can tell in there, the framing that they are using is fundamentally the local population that in Flint was in pure disadvantage. How the implosion happened in terms of institutional crisis, the government in terms of accountability and transparency, the private sector in terms of disinvestment, as we know, social because the local sectors were lacking that intervention to mobilize, and of course the media because they lacked coverage and they did not report in depth. Then it came the crisis communication management and communicating the crisis. This is part of the thing that we discovered in our analysis. At first, it was the crisis management. Then for the governor and the state officials, it became a crisis communication. But for the media, it was how to communicate the crisis, how to effectively communicate with people that didn't have access to be reading the newspapers because the local paper was only published 4 times in print, in actual paper, and the other time electronically or digitally. And my question always was, how many people in the city of Flint were able or subscribe to the digital news and try to look for the news that they were looking for? So it was a paradox of different contrasting elements in the communication crisis and the management of the crisis and communicating the crisis. And to summarize our findings of almost 600 articles that we did at the national, state, and local level, is that the press, and we're focusing primarily on the press, is that it failed to inform the public. The press failed to shape public opinion, to mobilize and pressure governmental officials to respond more rapidly and more transparently about the crisis. And the press failed to infuse agenda setting, mobilizing public officials to respond rapidly to the community. And the press failed to inform properly about the crisis. And of course, the government now is in crisis communication management. And you probably cannot read the cartoon over there in the bottom, on the right, but it says, the most disinterested men in the world. And it basically said, I don't always ignore crisis, but when I do, I try to lie. Something like that. Yeah. So thank you very much.
Thank you, Manuel. And now we'll hear from Trixie.
Thank you. I'm going to start with the words from one of our participants, Serenity 14. There would be more progress in things if we would work hard for what we want. I want to see more hardworking teens and less unworking, more helpful and less getting in trouble, doing things that we know is wrong. I think that if we find a way where more kids and teens can hear us young people, maybe they'll start thinking, I can really do this. I came from nothing and look where I am now, they'll say. I'd like to see more helping hands and more people that are willing to give without wanting something back. Just giving with the kindness of their heart instead of being the person with their hand out all the time. In the spring of 2015, the Writing Center was in the middle of its first community composing project. This one focused on Midwest hunger. We were invited to be a part of a College of Arts and Letters initiative through the MSU, UM, and Wayne State Community Engagement Corridors, quite a mouthful. This project was tied to Flint's own strategic initiative called Imagine Flint. The goal was to use arts and letters to help young people in Flint imagine a revised Flint, the Flint they would like to live in, study in, work in. The Community Composing Project, just a little bit of background, Midwest Hunger employed a multi-tiered format to enable robust civic engagement through artistic creation. Participants attended a variety of writing events in 2014 and 15. They composed a variety of written and artistic pieces, engaging with the questions, what is hunger and what do you hunger for? These community composing projects included 2 photo voice projects, one in Flint and one here in Lansing. The collected works were shared with Michigan composers who created 15 original musical compositions for diverse community and university choruses and 2 mass choirs. These original compositions were recorded and then premiered at a free benefit concert for the Greater Lansing Food Bank. Creating Community and Change Through Music was accompanied by an exhibit of both Photo Voice projects. And then the Flint Photo Voice project is on display here tonight as well. So I hope you'll look at that if you didn't get a chance already. The idea behind Photo Voice is to use images to relate to and challenge our worlds. Participants use photos to make a point or to tell their stories. They then add or layer written or oral text onto the images. The combination of image and story has the power to change viewers' perceptions and to send messages to readers and viewers. Carolyn Wang, foundational scholar and creator with Photo Voice, says that images contribute to how we see ourselves, how we define and relate to the world, and what we perceive as significant or different. She then adds that the lesson an image teaches us resides in how people interpret the image in question. The story or the voice helps audience members with this interpretation. So the question then is, how did this particular Photo Voice project engage the youth we were working with in Flint, and did it contribute to their lives? So for months beforehand, we worked with a half dozen community partners who were part of various organizations in Flint. They helped us determine specifics like the targeted age group. For example, we were going to work with high schoolers. They suggested we work with middle schoolers because they didn't have anything to do in the summer, and the high schoolers were all very involved in lots of other things. And the middle schoolers, parents mostly, would be looking for things to do and more likely to send them for the week. They helped us find the community center that we worked with, the time of day. They helped with the advertising. So our community partners were really important to this process. And all of this is happening then in the spring and then into the summer of 2015 while things are being covered up. And but we're engaging with the idea of hunger and what our students hunger for. So on day one, we put cameras in the hands of each and every participant and asked them to think about what hunger looks like and sent them out in small groups to take pictures. On day one, the reality of hunger also rumbled out from our participants' own bellies. We had previously arranged transportation for the kids, and our partners asked them to pick them up at a different community center where they were attending a different event in the mornings. So they were coming straight from that event to our event without any lunch, and most of them without any breakfast. So our plans had to quickly change from afternoon snack to lunch every day. We had to adjust, our budget and our scales. That was fine. Then we had planned to work with 10 to 14-year-olds, and we ended up with at least 6 8 to 10-year-olds, so we had to modify the curriculum, night one. But we did these things, and it worked out. As the week progressed, we all sorted through hundreds of images. We evaluated images, we revised them, we edited them, we set new goals, we took more pictures. And we asked the participants to write about what they hungered for in their communities. And throughout the week, we challenged them to record the images with a variety of techniques and perspectives. Perhaps looking at an object looking up through an object, or looking down from above, like this one. Perhaps writing on large sheets of butcher paper on the floor or through chalk on the sidewalk. We didn't want anything that looked like school. It was July. We took them on a couple of field trips and asked them to imagine what others hungered for as well. Throughout, we asked about their hungers, their desires, and how they could make their communities better. From the beginning, the youth engaged on both literal and metaphorical planes. These 8 to 14-year-olds hungered for pizza and popsicles, Fritos and cheese, their mama's cooking, and fresh meat and produce similar to what they saw at the farmer's market. They also desired more parks and play areas, suggesting that abandoned homes be torn down and turned into playgrounds, basketball courts, and community gardens. As Justin, 13, said, "I'd like to see more playgrounds for kids and stuff so we can have all these abandoned houses gone," that 25%. They also wanted nice cars when they got older, but pointed out the need for better repaired roads. But mostly they wanted people both inside and outside of Flint to see the value in Flint, to see the good things and enjoy them even while working for change. Ashton, 11, had this to say: "Although Flint may be what people call a quarantine city, inside of the city there are hardworking people, future people, striving to be better than what they are. That's why I don't want to move, because I feel like I've got a future here." We went into this project with the idea that participation in arts and cultural programming stimulates a lifelong love for learning, can provide safe outlets for self-expression, and encourages creative and critical thinking. I still believe in this and have seen this, but I would also add that it creates space for important conversations about life as it's being lived in the moment. Real conversations about learning and activism. It gives participants an opportunity to speak up in their communities and about their own lives. Even as we were there, the kids were talking about water. It hadn't happened. We brought in bottled water every day. The community center we were in said, don't drink the water. But nothing had been actually advertised in the news at that point. So again, they were living it, and it allowed them a space to talk about this. The sad part for me is that part of the goal of this Photo Voice project was for it to travel all over Flint, for them to have a voice, to be able to speak. And we were lining things up even as the Flint water crisis broke. And since then, all of our partners have been consumed with other needs and other ways. And the story and the voice and the dreams that these kids haven't been able to be out there in the community the way they should be, because they've been overshadowed by these other problems. So we're going to keep holding on to it and keep pushing, and we keep talking to our community partners that we'll still be here and we'll still have these when you're ready. And you know, we'll be ready to do another project. They had originally asked us to come back, and then that would have been this past summer. And our partners just said, there's no way to plan this right now. We have to deal with other things, which of course we understand. Trinity, another one of our participants, also 14, sums it up like this. People talk down on Flint a lot and they give up. You shouldn't be trying to criticize where you live. You should be trying to make it better. Like trying to build schools, teach the little kids how to have dreams and purposes and set goals for themselves. We could be hungry for so many things like education and freedom and more buildings. Later she adds, you do not have a purpose in life. You do have a purpose in life, and just because you are young, you don't let nobody tell you you can't do nothing. You can reach for anything. That's what this picture, Reach for Greater, is basically about. Thank you.
Thank you, Trixie. And I have to tell you, the hardest part of my job each time we have one of these forums is cueing the speakers that time is running out. And I know that it frustrates many of you. Do know that they actually did all finish. And when I can see they're near the finish, I don't pass the note. But part of it is because we want to ensure that there's time for you to engage as well. I'm going to share some things that I gleaned from the various talks that may also spark some questions. And I'm going to flip the switch a little bit tonight, and after kind of sharing what I heard across the 5 speakers, going to immediately open it up, and then as we have lulls in questions, give the panelists an opportunity if there were things that they heard in each other's talks to comment on that. So one of the things I need to do first, so Manuel commented on how the flow went, and it wasn't accidental. So I have to acknowledge my partner, Professor John Beck, who works tirelessly on this forum, and after he hears what people may talk about, really thinks about the flow and organizes everyone. And then also, I didn't acknowledge earlier and need to, Stephanie Seapack, Communications Manager for the Honors College, and she does everything necessary behind the scenes to make sure that Sharper Focus Wider Lens is a success. And our partners at the MSU Alumni Association for the live stream, we thank them. And so some of the things that I heard on this evening were cutting across multiple people about the poor policy decisions. Is it benign neglect or intentionality, right? And does it make a difference which it is? Maybe yes, maybe no, but how do you delve into what's really happening, and where does the responsibility for accountability lie? Who's going to be the watchdog? Who's going to be the enforcer? Who's going to implement what needs to happen? And when we look at what's happening in Flint, it's not a story alone for Flint. And yet, there are some cities who just grab the headlines, and it demonstrates that we probably need to be looking behind the scenes at some other cities as well. When you look at deteriorating fiscal situations, the state policy context that really limits what localities can do, and hamstrings everyone that says you can only go this far and no more. And if you're an urban core that's lost significant population, particularly population of wealth, what does that mean for the people left behind? And then the people making the decisions, are they really equipped to make the decisions no matter how well-intentioned they are? And what's the tension between urban cores, the outer ring, and suburbs, and how do we come to understand that we're all living together in the same region, even if we just change political or geographic boundaries? It's not like the situation is stuck in that one place. It impacts us all. And then what is the role and purpose of a non-elected, non-appointed official, in terms of non-appointed by people in the city? It's not civil service, someone kind of flying in and making decisions for a community, and the community has no say in that. And we've seen that with emergency managers for fiscal situations, for education. And what does it say to the populace about their own value? And then also thinking about the importance of making real connections with communities, not flying in or, with a solution and leaving, but how do you really connect with the community and say, I'm here to stay, we're in this together, we're gonna solve it together. And we heard about the reality of this water crisis, right? Some of us may not have known how real it is even today. And it points out that we can't sit afar and try to solve problems. We have to be on the ground, we have to be partners, and place really does matter. We also talked about the importance of data, the integrity of analyzing data, the importance of multiple methodological lenses or approaches to data, and the value of mapping, getting to the reality, disaggregating, not seeing everybody as this one big group, but really figuring out who's in the group. If we use the auto industry example, really looking under the hood to figure out what's the truth of what's going on, and who's being left behind. We heard about the value of jumping in and working towards a solution, and those solutions have to be individual and structural. It's not either or. One or the other is not going to get us there. We heard about the interactions between policy and practice. And a lot of times it's easy to go down one route and not the other, and not realize that there are connections. And if we don't think about the impact of a policy and what does it mean when it's implemented on the ground, and if we don't think about the things we're doing and yet there's no formal policy, and it becomes the de facto policy because we've done it so long and that's what everyone understands, what does that mean? And also incompetence versus willful ignorance. You can't talk about declining cities and not ask that question, and not look at who's left behind and what does that suggest about the intentions that were involved. And also being able to really pinpoint what's going on. And when Manuel talked about what the media missed, and he talked about global urban issues and global crises, it really brought to bear how much we rely on the media to tell us what we ought to think, do, know. And if the media isn't playing its role in setting public opinion and agenda setting for the government, then what happens? Who picks up that void? And the importance of looking at issues systematically, not just seeing a problem, one problem, and saying, that's it, and running. There's a whole art to problem identification, and all the stakeholders have to be involved, because it's those different lenses that really get us to what the problem is. And we can't get a good solution until we identify the right problem. And so taking that time up front. We heard about the difficulty of accessing data, or at least meaningful data, and data is not always numbers, right? It's the full context, but what do we do to ensure that we know that? It was really enlightening and heartwarming to come back to the value of arts and humanities in helping us understand social and political issues. A lot of times we want to jump on the economics or we want to jump on the politics. And we forget that people see and experience the world in different ways. And so we have to make sure that we create for that. And then how do we value our community partners? How do we ensure that what the community wants is what we are working to see happen? And our best solutions may not be the solution that matters for any particular community. And so how do we get to that? And finally, also thinking about our youth. They're watching us. They see the issues. They may not fully understand them, but they understand them pretty well. If you look at what's out there, if you listen to them, how do we make sure that we don't leave the youth behind and that we take their insights and use it as we move forward in the future? And so if we use Flint as a laboratory, unfortunately it's a very natural experiment, right? There are things going on there that we can't escape. How do we come out of what's happening in Flint with not only Flint being all the better for the horrible things that it has had to experience, but that 5-10 years from now, there's not another example somewhere else and we're not prepared to respond. There's always going to be crises, but how do we get ahead of them and ensure that we have strategies to respond and to maybe circumvent some things that don't need to happen? How do we get ahead of the poor decision making because people were left out of the conversation? So that was some of what I heard streaming through the different conversations. Want to ensure that you have time to ask our panelists questions. They are a wealth of knowledge. As you've heard, they're all passionate, and I'm sure they're looking forward to engaging with you. So I'm going to hand off to John to find our questions, and he may throw a couple zingers in.
Well, I was just wondering, Cynthia, if the panel wants to react just to your summation really quickly before we turn to questions out
Sure.
here. Anybody want to jump?
Maybe.
Okay.
One of the things that Cynthia mentioned is precisely something that I think that all institutions, in this particular case of Flint, did, which is the lack of accountability. And they are supposed to be empowering communities and empowering society, and they didn't do it. And the media failed to provide the voice to the weak. And I'm losing my voice because I'm attacking the media when I teach the future media scholars how to do it. So I think that it's an obligation of all the institutions to actually participate actively in the empowerment of those communities, all communities, of course, but those that are in disadvantage, those that are more vulnerable, are the ones that the media has an obligation to really actively provide a voice for them.
If I could add one thing to that, because I saw this ad and it called some various people in Flint who were mostly physicians and a few policy folks, the voice of the voiceless. And I will tell you that is wholly offensive to the people who have been crying out, who have been speaking out, who have been in protests, who have been in social media, who have been reaching out to all of their networks. Flint is not voiceless. Their cries landed on the earless. They were crying out, people weren't listening. And I am truly grateful. I want you guys to get Dr. Mona Hanna-Attisha, and if you talk to her, she's fierce, but she is very humble in many ways. She has been touted as the hero of the Flint water crisis. And when I tell you, she sort of like puts her head down when you talk about her that way, because I don't think she even sees herself that way. She sees herself as somebody who's proud to have been the one to sort of sound the alarm that actually raised the bar for the national media attention. But she was by no means the first one to cry out. And we're truly grateful that her outcry and the work that she and Dr. Sadler did, and that sort of seminal publication they did with Mark Edwards in the American Journal of Public Health, finally kind of tipped the scales. But it is not a voiceless city. And I agree, I'm really happy to hear other people from the media, because people have been wondering, like, why did our cries sound better coming out of the mouth of a physician than it did the citizens who knew what they were experiencing? You don't have to be an environmental toxicologist to know that your water doesn't taste right, look right, or smell right.
Okay, now I'm going to make a slight change just to tell you that the next Sharper Focus Wider Lens is actually on April 6th, which is a Monday night rather than the 7th.
February.
Which one?
February.
I mean, February, what am I saying? February 6th, so do come that night instead of the 7th, because we won't be here. Okay, and also want to tell you that there's a sign-in sheet near the cookies, which is always a good thing. So please do sign in so that we can make sure that we get you on our mailing list and everything else. At this point, I'd like you to raise your hand and then I'll come over. It's kind of a exercise program for chubby older professors, okay? We get to run around rooms. So raise your hand if you have a question or a comment for the panel, and then I'm coming to you. So let's see some hands in the air, right over here.
This is kind of a question to the entire panel at once, so I don't know how that's logistically necessarily going to work. But just especially as students, our best opportunity to make any sort of statement on the things going on in our state is tomorrow with Election Day. And most of you alluded to the fact that there were quite a few political failings and mishandlings that led to this, whether it was intentional or not. Just what, again, like she led with, without proposing definite solutions to things that there aren't definite solutions for, like what is some advice or thoughts that you have as far as ways political action could help instead of hurt in the future? Like where could things have been done better and what could have been done better?
I mean, this is, like with any of these answers, probably going to be only a very partial proposed solution, but to me, some of the issues go back 50 years in the way that the state handles general urban policy, so laws passed that support the incorporation of charter townships and prevent the central cities from annexing land, and that, I mean, it's been around for 50 years, so it's frankly kind of bipartisan. In some sense, it transcends party lines, and some of the more recent issues are more directly in one side, but it's to me, like, some of the policy action that could take place would be trying to get the state to understand that there are state level solutions to this in other states. So, you know, point to successful cities, Louisville, Lexington, Jacksonville, New England cities. There are cities all across the country, left, right, up, down, and sideways, in terms of political orientation, that have amalgamated county governments, and they don't have the same sorts of health disparities. And it's a proven fact that communities with more political fragmentation have more social disparities as well. So helping our elected officials see that as it shouldn't have to be a partisan issue. It should just be something that we do.
Okay, we have another question right here.
There's something that's been bothering me about this whole issue, and you have touched on it some, and I'm not sure that you can really answer the question, but if the state had headed off this crisis so that there was none to begin with, it would have cost the state a certain amount of money. However, if you create a crisis, you get a flood of federal money. Was this deliberate for this reason?
No.
And also, I would like to comment on the media. Was there lousy coverage due to the interests of the owners of the media?
I have to say, obviously can't speak to what was people's intentions. I mean, this really looks like two things to me. Good old-fashioned greed, the few bucks that got saved by not putting the anti-corrosive in the water, by making the switch in the first place, by not taking the offer to switch back and get a big waiver. I mean, GM said it. We can't use this water, it's corroding our car parts. So people knew within 4 months, forget about all the residents' outcry. GM said this water is corroding our car parts. So a lot of good people, in the face of strong evidence, did nothing. That's how things stay bad. Good people have to do nothing. So I don't think this was a deliberate act to somehow deliver Flint massive resources. I think this was a lot of good people doing nothing and wholly insufficient accountability on the part of our government, municipal officials, elected officials, and I think the media. But I don't think there was anything deliberate about it that was for the betterment or the good of Flint.
Just on that, I don't think that it's an accident that I think that the New York Times illustrated this very, very, very clearly. If the corrosion and the problem of the water and the switch of the water supply would have been in the suburbs of Detroit, the mobilization, the reaction of the media, and the community intervention to force political and governmental action would have been completely different. And I entirely agree on that. This is more systemic, and again, I'm gonna give you my biases. I think that it's not just one solution. It has to be connected with education, with empowerment, with bringing to the classroom the idea that if you organize, you have a better possibilities to change your government and make your government accountable. I cannot believe the conditions, the fiscal conditions in which Michigan is. I can't believe it. And the political will, in order to make those changes, is not over there in Lansing. And I don't think that it's going to be over there. And any legislature that is trying to bring the idea that we need to move taxes perhaps a little bit higher or to do certain decisions in order to perhaps increase the conditions of the state, that proposal is dead on arrival of who is in Congress right now, here at the local Congress and the state Congress. So it's a combination of issues. It's again, systemic. It's not one thing. It's probably multiple things that we need to be doing. In terms of the media, if the media didn't ring the bell and actually raise the crisis at the time when the scientists were bringing this to the national attention, it was connected with the ownership? No. It was connected with the disinvestment and the incapacity of the editors at the local level to go after the news, because they were very complacent and very comfortable with getting the news from the press governor's office instead of going deeper and trying to analyze what exactly the problems are coming from. And they missed the ball. And they missed the ball. It was a failure.
We have a question right here.
Hello. This question is for the whole panel. What would you guys say to a young mind who wants to ultimately have as big of an impact as you guys have had, not only for crises like this, but for future crises that will happen, but don't know necessarily where to start to make that big impact?
I can just kind of speak really briefly to my experience. So I grew up in the Flint community, and while I was a grad student, just started volunteering with things that I cared about. So I started volunteering with a local food group, and that led to an internship at the land bank, and just doing things that I was passionate about and doing them with integrity, to borrow a word Deborah likes to use a lot, really investing myself in them and getting into the community afforded me the opportunity when these job postings came up to position myself and say, hey, I'm from the Flint community, this is what I do, I care about the community. So I think it just has to do with your level of genuineness. Just do what you're passionate about and do it, even though that's probably kind of trite.
Well, yeah, and I would piggyback onto that, and I would also say, I always say in public health, there's a seat for everybody at the table. And I think everything that was talked about here falls under that umbrella, from communications and media and economic development and the work of extension. And so it's also important that you be an expert in what you're an expert in, right? So there are things that I do out in the community that I do as a member of the community. And then there are things that I do as a Hopkins-trained epidemiologist who you can't juke me with the numbers, right? And so I think it's important that you bring your expertise to the table. So whatever it is that you're called to do, I always say, if you're a statistician, we couldn't do what we do without really well-trained statisticians in the background. There are math theorists and people who are developing new mathematical and statistical models to give us better ways of understanding outbreaks and crises and responses. There's real modeling in the background of that. There are nurses and caseworkers who are on the ground floor providing the care for people and doing the outreach, so that when we have a Medicaid waiver, we actually have people to get out and get the word out to communities and get people enrolled and help coordinate care and things like that. I mean, it's just, whatever it is where you see you can sort of join the fight, really build yourself as an expert in that area. You know, I think as an appropriate public health response, could we have gone out and distributed water? Could the faculty in our division and all of the staff in our building have gone out and distributed water? Of course. But that wasn't what we were called to do as public health professionals. It was Dr. Sadler who did the GIS work for the seminal piece that Dr. Mona put out. If he was out busy distributing water, she wouldn't have had the statistical power in the background to actually make the case that they tried to discredit her with. So I think it's very important that you build yourself as an expert and you really wear with integrity the hat that you're wearing, and you're getting that training right here in the Honors College. So bring to bear those gifts and talents and that knowledge and information. What we need are real experts in the field with the passion, the commitment, but that solid training to do the work that's going to make a difference.
I would add one other thing, and that is really practicing active listening, and this idea of even while you're in training, when you're volunteering, all these things, is really listening to what the people that you're working with are saying they want and they need, what the problems are, because going in with your own solutions won't necessarily solve the problems. You have to really listen to community partners, to those who are, you know, whatever they're experiencing, and listening to the experts and thinking about how your knowledge can contribute to that and how you can help put the pieces together.
Okay, please raise your hands, but on my way to this man who's right here, I'm going to ask a quick question before I hand him the microphone. Manuel, you really began to lay it down, but I want to ask the question of the panel. Emergency managers have been used across the state of Michigan in almost every case. They are dominantly minority communities or school systems where they're used. Often we talk about environmental justice as really environmental justice that it really is built around race, so that many cases it's disadvantaged communities by people of color who end up with the worst deck of cards that are dealt to them from an environmental point of view. Can you help us understand a little more about emergency management, Mary, in terms of the fact that, you know, where are we going with this whole emergency manager thing where it always seems to turn up that card?
Well, I think the state has learned, or hopefully the state has learned, that it may not be the most appropriate approach to managing local fiscal crises. And as you may have seen in the recommendation from the governor's own task force that looked at this, and then also the legislature recently came out with a report that also recommended not to have a single person call the shots, but to have, at a minimum, a team approach to helping work through these fiscal crises. Fiscal crises will happen. They're not going to go away, so they have to be managed in some way or have to be addressed in some way. But they don't have to be addressed the way Michigan has chosen to address them. Other states do different things. For example, California doesn't do anything. If you are a local government and you are in trouble financially, go ahead, declare bankruptcy if you feel like it. The state has a completely hands-off approach. Other states have different approaches also.
Looking forward to the future of Flint and trying to kind of rebuild the city, it seems that we really need to increase jobs, both to decrease the unemployment rate that's currently in the city and also to bring people back into the city to reestablish this property tax rate. Can you think of any specific growing industries or services that would have some sort of comparative advantage for locating in Flint?
I was going to say, the two academics lean up. Well, there's a growing academic build in Flint. That's an interesting but small but important piece. The other thing I can say is that there have been several economic development efforts. So Flint, how big is downtown Flint? I sort of say it's like 3 blocks long. I have people that come and visit, and I'm like, if you come for 4 days or less, I can show you the time of your life. After that, we're just going to be doing the same things that we did for the previous 4 days. But there is sort of a budding downtown, and there are lots of economic development initiatives underway. And one of the things that I know that people are looking at is, there are lots of places in Flint where, right next to where I live, the factory is not there. It's just like a big grassy knoll. So there are these sort of remnants of industries and other things that were there, but there are still lots of industries right around Flint. And there are still many people that are wholly committed to the city of Flint. So one of the advantages for the people who are willing to sort of take the leap is the housing stock in Flint is pretty high and housing values are pretty low. So I got a house in Flint that, if I were in East Lansing, would probably be off of my financial scale as a professor, right? And so there are lots of things I think that can draw people both to the city, and there is a budding sort of commerce in the downtown area, and the academic and the health sector in Flint is really growing. MSU, for example, trains a lion's share of their 3rd and 4th year medical students in the hospital system in Flint. And there aren't just doctors in that system. There are nurses, there are health workers and things like that. So I know that there's lots of economic development, but there's also a budding and strong, vibrant academic and health community in Flint.
And that's kind of part of the challenge, is that so much of the growth is like in the meds and eds. It's the downtown, it's the gentrifying, it's the trendy, and so it's kind of creating like 3 Flints. There's like the fancy downtown Flint, there's the suburban Flint, which is, has a concentration of white collar workers, and then there's the rest of Flint, the rest of the city of Flint. And so the challenge going forward is how to deliver equitable economic development. And so, just for instance, one of the ongoing issues that we have is now, because the factories have all split town, the MTA, the Mass Transit Authority, actually has a program where they will bus hundreds of workers to Livingston County, to Howell and Heartland, where there are new factories. And so, again, that's a place where the state could step in and say, hey, nobody lives in Livingston County. I mean, lots of people do. Relative to Genesee County, there's all these industrial jobs in the woods. How about instead of building these shops in the woods, we build them on the grassy knoll next to Deborah's house again, and then people can just take a city bus or walk to work. And so then we eliminate the need to spread employment over these massive regions.
And that problem is confounded by what we're dealing with the water and some of the other structural challenges. So you said it best, there's like no one solution. It is very multi-sector, but I can say there are efforts underway, and people are coming together to put together comprehensive plans that have active community voice, that is built on not just the ideals and the thoughts of the government or of the meds and eds, as Rick calls them, but really is a comprehensive approach where no voice is left out, including the voice of the residents themselves.
And tied to that, it goes back to the question about how do you get involved. So remember, this is a state with pretty restrictive state policy. So if you want to see reinvestment in local communities, you actually need to loosen up some state policy. And so some of you could be working for the state, advocating, lobbying the state to make sure that the state realizes that because the state has said, okay, we can have all these local communities, now we need to be responsible to the communities.
This may be very similar to what you were just saying, but I was just kind of thinking in the midst of the break of the crisis, the call to action was very big in there, and people knew what they could do to take action to help the citizens of Flint. So kind of looking to now, what can all of us in this room do to help make sure that people are still hearing the voices and are still paying attention and still being able to take action to help the citizens or the ongoing health implications, et cetera, that will be coming with it.
I can tell you one of the things that we're doing that I think is important is, I tell people that the impact of what happened in Flint is not something that we can quantify in the next year. There are babies who were conceived and born and raised in their formative years on Flint water. And then those babies have undergone both some social and behavioral assaults as a function of that, but then also some biopsychological assaults from that. Those things trigger literal changes, epigenetic changes. Those will potentially be transferred to their offspring, who will then be raised by parents they're 2 years old right now. Can you get that? They're 2. They're going to show up potentially, and this is a lot of what the Pediatric Public Health Initiative is about, and some other efforts that are being done by MSU and some of our very strong partners, both in the hospital and in the community. So we're doing all that we can and mounting everything that we can to undo some of that. But the reality of it is we have very good data to show what is the long-term impact of acute high lead level exposure at these formative years. So these folks are going to have both some psychosocial potential problems, and they're going to also carry this now inherited risk that they're going to pass on to their kids. So I think one of the things that we can do, and the media can help with this is not going to go away unless we let it. So it is our job in 20 years to make sure that people don't forget. It's our job as both scientists to make sure that we continue to do that research, because it's intergenerational. We're not going to just have to look at these 2-year-olds when they're 20. We're going to have to start looking at their kids when their kids are 2-year-olds, and then their kids' kids. We're going to need the media to be our partners in that, because it's not like people have forgotten. People haven't forgotten, but there has been sort of a little bit of a waning of the attention. So it is our job to make sure that we keep the flames fanned, because this is something that I think is really going to take 60 years for us to really undo.
One of the saddest things that has happened in America is something that we lost roughly around the 80s. It's called social capital. It's the capacity in which the communities thank you. The capacity in which the communities were always able to resort to their own resources to solve problems. We lost it. We lost it. Social media is now capturing a little bit of the social capital, but it's still too loose to make it cohesive. And I'm glad that Deborah recognizes, or well, all of us would recognize that the problem is going to stay here with us for the next 25 years. And we're going to need to become active for the next 25 years to ensure that not only Flint, but the rest of Michigan is protected. And we need to increase social capital, and all of us will play a role, and all institutions play a role. And not just tackling the crisis of Flint and then disentangling from the rest of what is going to happen later on in Macomb, or is going to happen over there in Charlevoix, or God knows where. So, yeah.
And just one thing to add to that, too, there's reason to research to suggest the connection between decreases in social capital and increases in suburbanization. So right. we decided to stop building cities and just start building subdivisions. And so it's not just that we're disinvesting in our central cities, but we're not building new cities. And so there are these casual places like, on any TV show where, the neighborhood coffee shop, most of us don't walk down the street to get a coffee and then a loaf of bread. And so we don't have those same informal connections that we used to, because we can't, because we all live 20 miles from work and 10 miles from school and so forth. So we're all in our cars all day. So, yep.
I would also add that not just in Flint, but statewide, Michigan has disinvested in education, period, especially with cutting so many of the extracurricular things or things outside of the very basics of education, which actually increase learning capacity and increase their ability to learn and do well in school. If you take away the arts and you take away music and you take away the things that some of the kids came to school for, then they don't have a reason to be there, and they don't have a voice, And even in the basics of writing and things like that, they're not being taught to be self-expressive or to get to write their own work because they're writing for a test that doesn't tell us anything and just inhibits education. And so this is a statewide problem that's going to continue to get worse if the state doesn't do something about its own investment in education across the board. And there are some school districts who can supplement what the state is doing or can override the state because they have enough capital and they have enough power to do that. But a lot of these places, like Flint, like the Lansing Public Schools itself, don't have the power and they don't have the capital to override that, and so they just let it go.
Now, I'm going to have our last question here, and then we're going to be open to have everyone rush the platform to talk to our speakers. So, right here.
All right, so my biggest concern with this whole situation is that the people that should be held responsible for it will get pushed to the wayside by just trying to figure out a solution to this massive problem. And for me, I'm an engineering student here at Michigan State, and the story problem of switching a city of 100,000 plus people from a Great Lake, big body, low mineral water to a local river with high mineral content, how do you look over the fact that the city's, water structure is over 100 years old? How's that not a variable in your decision? I just think it's kind of stems from the people not having skin in the game by being appointed by the state. And I guess my question to you is, who do you think should be held accountable for this whole mess? It's going forward.
Wow.
Yeah.
Before they answer, if they answer, these are individual responses.
I was going to say, I am a new CS Mott endowed professor. I really enjoy my job. I do the work that I think makes a difference. And I think that that's a great, great question. And if I thought my answer would provide anything or move the needle, I would name names. But I think we're all pretty clear. And I will tell you, the media is an interesting place. So you said you scoured, 600 articles? And I can't even imagine. I'm hoping there's some summary stuff that you guys will produce out of this, because I would love, love, love to see it. But if you are really interested, it's sort of all right there in black and white. And the New York Times and some other people did a really great job of putting together a pretty comprehensive timeline. And I know a lot of folks here at MSU, especially in the College of Communications, have done a really good job of putting together the timeline of what happened and who did what, and there are names associated with that. So I would actually take that and push that question back on you. With your brilliant minds, with your analytical skills, with your powers of deduction, when you look at that, what pops out for you? And then how you exercise some power and freedom here is you have a voice tomorrow, right? You actually get to say, this didn't work for me. This doesn't set okay with me. And you get to make those decisions for the residents in Flint. They are, making those decisions for themselves. And I think it's all right there, but it really is for you to answer that question. And I think the power is really in the inquiry. Who is responsible for this? You ask different people, you'll get different answers, but I think you can actually generate that answer for yourself.
And
that was real political. Keep my job.
Not to discourage you, and also to kind of dance around the question, because I don't think I'm qualified to say who exactly is either, although I have a sense. But a very similar thing happened in Washington, D.C. about 12 years ago or so, and Mark Edwards was on that case with his team, and so that's why Mark Edwards from Virginia Tech wound up in Flint. But that whole incident where hundreds of more kids were poisoned by lead and water yielded zero culpability. Nobody was found to be responsible for it. So it kind of just speaks to the complexity of how do you hold an individual responsible when maybe there was 15 people who were kind of responsible, plus a whole system of 60 years of screwing over cities. So.
I mean, to a certain extent, though, the emergency manager reported directly to Governor Snyder, and he's confessed that he knew about it before it was a public emergency. And there's really only one, the guy who worked at the water treatment plant, who approved everything, two, the emergency manager, that, like you said, who did recognize that the GM plant could not use the water, and signed away their right to switch to Detroit water while leaving the rest of the city, with the lead water. And then it's pretty much just the governor, because he reports directly to the governor, and they're trying to sweep that under the table, hoping it will go away. So
That is an interesting analysis. I wish you had the mic.
Well, actually, one of the lawsuits is precisely following that.
Well, and let's just remember that all of us bear personal responsibility for affecting the things that we can affect. And I think that's what Deborah was talking about in terms of tomorrow's election. But it's true in terms of how well you keep yourself connected to the information about where you live and what you do and what affects you and what affects your neighbors, and how much responsibility all of us take in terms of that notion of building of social capital. To what degree can we really strengthen the bonds with the neighbors and people who live outside of our neighborhood but are truly our neighbors, in terms of interconnection? Now, I'm going to turn it back over to Cynthia, but I want to thank Trixie for bringing this wonderful photographic and writing display in the back. If you haven't had a chance to see it once we break up here, please do check out that not only is that there, but also some wonderful books that are available free back on the table. And there are more where those came from, and Trixie can tell you all about that project. But back to you, Cynthia.
Thank you, John, and I hope you will join me in collectively thanking Mary Schultz, Dr. Deborah Furr-Holden, Dr. Rick Sadler, Dr. Manuel Chavez, and Dr. Trixie Smith for being on our panel tonight, for having an engaging conversation. As always, I thank you, our participants and our live streamers. Let's just do a round of applause for everyone. We always end just shy of the hour to give you an opportunity to interact with the panelists, and so you are now free to do so. Thank you.